Good afternoon, everyone. We welcome you on behalf of Kahos Healthcare Engineers Forum for the first webinar series of the year 2026. Know Your Biomedical Equipment, Decoding Kardia 12L Innovations in 12 ECG. And we have with us today our speaker, Mr. Kartik, Director Marketing from AliveCore India and APAC. Sir is having 17 years of experience in the medical device industry as marketing head. Over to you, sir.
Hello, good afternoon, everybody, and thank you for this opportunity to speak on our device and also to update people on the latest innovations that are there on Cardia 12L. I'll quickly share my presentation. So I'll just start with it. So, decoding Cardia 12L, innovations in 12 lead ECG. Now, I'll take you through what Kardia 12L is, who is the manufacturer of it, and what is the latest innovations that one can get to see through Kardia 12L. Yeah. To start with a quick introduction, I'm Kartik. Thanks to Jenifer ma'am, she has already introduced me. I head the marketing vertical for India at AliveCore. And I have had 17 years of experience working with multiple brands in the medical devices industry. Again, thank you for having me here today. And it's a pleasure to kind of impart some sort of knowledge that could be helpful to know about the innovations into our lead ECGs. AliveCore, as a company, has a mission that is to save lives and transform cardiology by delivering intelligent, highly personalized heart data to clinicians and patients anytime, anywhere. This is our mission, and our innovations are all to do with, catering to our mission. Throughout the webinar, basically we'll be covering few topics. That's basically the trends and gaps of the 12 lead ECG that is currently existing, and an introduction to Cardia 12L, its components, what is it made of, and how does it optimize the clinical workflow. Now, there are lot of 12 lead ECGs that are there in the market, and it's used in multiple places, be that be a small clinic to a major hospital or to somebody who is doing it a personal use. When I say personal use, a small to small clinic that I'm talking about. Now, there are major trends that are there with that. There are gaps associated with it. So, what is the first trend that we see? Uh, medical. Firstly, am I okay to ask questions or is it a one-way interaction?
The participant can post everything in the QA box on chat. If you ask question, they can answer it in the
Perfect,
chat box.
perfect. So, as we all know, there are multiple components to a 12 lead ECG. The device would look something like this, right? And there is a card that is required. There is a personal that would be required. Then the patient has to disrobe himself or herself. And then, it's an entire setup that would be required, right? Now, for everything to happen from starting to placing the device on putting on the wires and making sure that there is a person who's always there. In terms of putting the wires, also there are checkpoints that are required while one places the wire. Sometimes the wires gets reversed. That is what we have heard mostly, and everything requires a bit of time that goes towards it. Now, in a big hospital or in a hospital where multiple ECG tests are happening, there is always, of course, an expectation that one needs to complete the ECG test at the earliest. And for any test to happen, this overall setup of the time plays a critical role. Yeah. Second thing is interpretation skills. Interpretation skills, of course, this is on the user point of view, where maybe if it's a physician who is using it for to take an ECG, sometimes the output would be something which they would be aware of, and sometimes they would need the help of their peers, be that be a cardiologist or somebody giving a second opinion. And many of times it is also that while somebody starts using the ECG, there's always a learning curve in getting the interpretation better from wherever it is, right? And sometimes accuracy becomes a very critical part while an interpretation is made. Yeah. Third thing, patient centric. Now, when an ECG device is there, uh, how much is it centric to the patient, right? One of the major things that we have seen or the patients face as a discomfort maybe is when they're asked to disrobe entirely for the placement of the leads, right? So what if there is an option where, the patient doesn't really have to disrobe completely? Or if, say, for example, if a female patient is there, of course, there is always a need of a female patient to be around while this disrobing process is there, right? Another thing is, what if a patient is immobile and mobility is a challenge for the patient to come by to the hospital or to a place where the test can happen? What do we do? Can the ECG machine go there, or what is it like? If an ECG machine has to go, there has to be a card, there has to be a person carrying it, there has to be the entire paraphernalia that has to go along with it, right? Then comes emergency. This is very, very critical for anything to do with medical devices where emergency plays a major role, right? We might have all come across sometimes healthcare professionals speaking about the importance of golden hour, right? When a person has faced any sort of an uneasiness and it has been indicated that the patient has to go through a ECG test. It could be possible that the patient has already come into the golden hour of an attack, right? Then, basis the time, how quickly an ECG machine can come to the patient or the patient can come to an ECG machine. The reach plays a major role here. And for anything, when it comes to reach, it's all to do with the flexibility to carry a device, right? Errors. This is again something very, very important for anybody who does an ECG test, that you know how accurate or what is the quality of the output that they're getting. Do they really need to redo it, or it's all something that they're okay to go with? Many a times there are situations where a test has to be done again and again. Now, when a test has been done again, what is the time that goes in being spent out there, right? Then comes documentation. In today's date, every hospital, one or the other way, has made the priority of keeping sure the documentation is done properly. Other way to look at it is now hospitals prefer going from analog documentation to digital documentation. Why? Because sometimes retrieval is easy for anybody to refer to any past records or even to preserve the test reports that way for the patient both and even for the hospital, right? Then comes follow-up. This is again something which is to do with the user. When a patient is going through a particular condition or is being diagnosed with a particular condition, prescribed a particular medicine basis the condition, there are at times the physician wants the patient to undergo multiple tests in a day sometime, or in months sometimes, or in weeks sometimes, right? Now, keeping on to these kind of periodic tests, it would have been very good if the patient had all the data at one particular place, or the doctor had a point where they could access all the historical data at once so as to understand what is the progress of the patient, or rather how the molecule has been working for the patient. Now, these are all the trends and certain pain points that are related to the ongoing trends that we happen to find out in various setups that we have here in India or even at the globe. And that's how we came up with something very, very interesting, very, very innovative. And there comes this product called Kardia 12L, introduced by AliveCore. And I'm having the pleasure to introduce to you all Kardia 12L. What is it? What is exactly Kardia 12L? It's a 12 lead ECG that looks something like this, a small ECG module with a wire to it, which is known to be or called as the pocket size ECG device. And it's also known to be the world's first AI powered handheld 12 lead ECG to include a unique single cable design. Now, we'll talk about what this unique single cable design is. But what is it for anybody right now who is seeing this webinar? How does it make a difference for them, right? Well, for somebody who can have a Kardia 12L, what benefit they get is uh, portability. It's highly, highly portable because of its size, because of the make of it. It is known to be very clinically efficient. I'll cover that how it is clinically efficient because a lot has gone to the manufacturing of it in terms of validations and training. And then ease of use. Anything that is new in the market or is introduced technology-wise has to be easily usable by anybody, right? And keeping all of this into mind, not just as a new product, but also in comparison to the ongoing kind of 12 lead ECGs that are existing, how easily it can be used is something that Kardia 12L is known for. Let's deep dive further as like what Kardia 12L has to offer. So far, any questions by anybody? Ma'am, please let me know if there are any questions that comes your way because I don't or I can't see the chat box. Sure. Okay, I'll proceed. Yes. So Kardia 12L, again, the easiest way to acquire a 12 lead as I was mentioning, right? This was launched in US in 2024 and we got our CDSU approval, everything, and it was launched in India in 2025, right? And when it was launched in US, what is the kind of noise it made? Well, it was been awarded as New York Product Design Award Gold winner in the medical devices and technology category. It was again in the innovation and technology category in Best in Class Business Award in 2024. Mm, there was another award called Edison Awards that we got in healthcare environment and patient care solutions category. And then in 2025, we were known to be world's top health tech companies in 2025 because of this particular innovation. Now, with all these awards, I'm sure everybody would be curious to know what Cardia 12L is and how does it look like, right? I'll play a video and then we'll cover the rest of the topic. Yeah, thank you. Thank you. That's overall the way the Kardia 12L device works. And if you would have seen, it just came in a small briefcase. It had three components that was mentioned about, and it was easy to be placed. And if you see, the patient there was not entirely disrobed, and the ECG reading was also parallelly taken through a device that was again a digital thing, right? So we'll talk more about it as like what it is. But before we go ahead and talk as what is Kardia 12L, it's good to also understand what has gone behind the making of Kardia 12L, right? It has gone through a good amount of AI training and validation with around 1.75 million ECGs from leading US medical centers, 1 million ECGs for just training, and 750K ECGs for validation. But while this readings were taken or these validations were done, it was not just done on one set of data set, but highly diverse data set, different genders, different race, right? And then one of it is also one of the few AI ECG algorithms developed with large cross-institution validation data. So it's not just of one institution, but cross-institution validation of the data that has happened here. And there is also no overlapping in the training and validation that has happened, which means exclusively 1 million ECGs for training and exclusively 750K ECGs for validation. With this, we have also got FDA clearance on, sorry, I'm not able to. Is my screen still visible to you all?
Yes, sir.
Okay, okay, I think. And in that case, yeah. So the FDA clearance is also on basically the substantial equivalent to a 12 lead SL algorithm that is of GE Healthcare. And how does this work? The Kardia 12L has 8 standard diagnostic bandwidth leads, out of which 4 are recorded, that's the physical leads, and 4 are derived. And then there is a concept of synthesized leads, where with the help of machine learning, you get to see another 4 leads. So with 5 touch points, the user ultimately gets 12 leads output. Yeah. Now, how accurate is this data? What is it like? Is it equivalent to the 12 lead ECGs that are already existing? Yes. There was data presented by Heart Rhythm Society 2024, which gives a research paper called as Diagnostic Accuracy of a Mobile Artificial Intelligence Guided 12 lead ECG, which showed results from a clinical study on 200 patients. And then what it conveyed is this approach has significant implications for rapid ECG diagnosis in clinical practice. So that is the backbone of what has gone into the development of the Cardia 12L. And mm, how does this AI flavor work for Cardia 12L? It is not just in the way the ECG reading has been taken, but also Cardia 12L detects 35 kind of determinations, cardiac determinations that are again FDA approved. So what are these determinations? These determinations are 4 rhythm determinations, and then there is 21 morphology determinations. And not just that, we have recently got clearance for 4 more determinations that goes to 39 determinations. And the journey hereafter goes on where more is going to come. So that way, what gives peace of mind to anybody who is doing a test is not just the output, but also an AI-enabled determinations, which is backed by FDA in terms of getting its clearance, right? So there's so much of assurance that comes, not just the output, but also the evaluation of the entire output of an ECG that physician gets to use it, or even a lab technician gets to use it while using the device. Now, what does the inside of Kardia 12L consist of? It's firstly a resting ECG system, which has a very simplified lead set technology. And the USP of this device is the unique single cable design. If you see, it starts from here and then goes just like here, and then goes here, and then ends it here, right? Just a single cable. And the module is, of course, here right now. If you see, the module is here. So the module just weighs 135 grams approximately, and it has got battery to it. So it's battery operated. So there is no electrical dependency. It is highly durable. We have done durability tests as well. And the way it is made, it is easy to store and carry just in a briefcase. Clinical efficiency wise, it is known to be faster than the conventional 12 lead ECG that is there in terms of its acquisition time. And there is no need of the patient to fully disrobe here, which means there is greater patient's acceptance for this particular thing. Easy to use, yes. Here, instead of the conventional 10 electrodes that are used here, only 5 electrodes are used in terms of placement, right? And since it's a single wire, there is no worry or concern for the wires getting tangled while it is placed on the patient's body, which means there is a lot of saving of time, which is to do with the overall setup of the device while taking an ECG test, right? And regulatory wise, it's cleared for use in US and in India. It has got FDA clearance, as it got CDSO clearance as well, CDSO approved as well. So
Right,
the carry case, yeah, sorry,
and Kanta.
sorry, someone was saying something.
No, sir, you can continue, sir.
Okay, okay. So the device would look something like this, coming in a carry case, very handy, very portable to look at, and it would have a patient lead wire. That's the unique cable wire that I was talking about. Then this is the module. Screwdriver is there. There will be snap to tap adapters, and with the pack that we provide, it will have around 100 tab electrodes that would be part of it. Uh, there are many off-the-shelf electrodes that are present in the market, and you could use any of the button electrodes that you can use along with this. Uh, However, with for the setup to start with, we anyways provide 100 electrodes along with the package. Operation wise, this is the backside of the module. This is the side of the module. This is the front of the module. It has a power button. It has a LED light to it. When we press the button, there is an indication that comes to it. There is a coupled mechanism where the cable gets into the ECG module, and then this is how the connector port looks like. Operation wise, it runs on BLE technology since it's BLE enabled. Uh, the ECG recording bandwidth, I think that's also something that would be important to us. You all is around 0.05 to 150 Hertz. Uh, the batteries that it holds is two alkaline batteries, which has the capacity of up to 8,500 recording life with just the two batteries, right? And the expected service life of the entire device is 5 odd years. Durability wise, it has gone through multiple tests or the required test that is required. Be that be protection from dust, be that be protection from splashed water, be that be drop resistance. It's IP54 tested standard wise. Thermal and altitude specifications are as mentioned. In terms of cleaning, as you've seen in the video, it is not antibacterial and it requires a wipe to clean it up, and that's the best recommendation practice that we suggest. Yeah. We were talking about the wire. How or what is this wire consisting of? This wire consists of this 5 electrodes, if you see here. RA, V1, V2, V4, LA, LL, right? And this 5 electrodes eventually gives us the 12 lead output with the synthesis of it and with the derivation of the leads accordingly of the system that the system follows. The wire is around mm, 2736 mm in length, and it is length is good enough to even take a reading of a patient who's more than 6.4 or nearing to 6.4 feet tall. Yeah. So the length is sufficient because we have taken up the global demography while manufacturing this particular product. The electrode that I was mentioning about, there is also something called as snap electrodes that can be easily used. Lead wire will work with even reusable electrodes. However, AliveCore doesn't recommend specific reusable electrodes in terms of recommendation. But since anything can be used, it's part of it. What we provide is the 3M electrodes as a part of the package. And basically, the snap to tab adapters are something like this, where the electrode could be used in terms of just attaching it to this, right? This is the adapter. This is the hardware component of it. Now, the output of the device is basically the main thing, right? This is where a lot of things make sense. So it is equivalent to a 12 lead ECG report that you get to see here. This is an output that has been taken from 12 lead Kardia 12L basically, and it shows about acute anterior MI. So this is the look of it. Now, uh, how is this optimizing the clinical workflow? I would take some more time out here in terms of letting you all know that we covered the hardware part of it, right? There is also the software part of it. What is the software part of it? The software part of it is nothing but it takes an app. This app is basically you could use it through Android and iOS device. It can be easily downloadable. It's a free app. And what it does is it takes the ECG report and it also pushes to something called as Kardia Pro portal. Now, this is a software and this is also a software. So what happens? Everything that has been taken as a test is digitally saved, not just saved, but when it's pushed to the Kardia Pro portal, the physician or a healthcare professional who has access to this portal can actually use the ECG data in terms of analyzing it, managing it, reviewing it, and even annotating it for their records. Now, how robust is this entire workflow? The entire workflow is very robust because the way it is made and the compliances it follows at every given part of the flow. It has got FDA clearance, as I mentioned. It has got CDSU approved that makes us use it in India. One of the things that is also important to know is even if it requires net, at an offline setup, it can still record the ECG. That's a very big thing, given the fact that, there are at times there could be an offline environment. However, the moment one comes to an online environment, it can then be pushed to the Kardia Pro portal. And again, whatever data that is stored in Kardia Pro portal or is accessed through Kardia Pro portal by a physician is HIPAA compliant and SOC2 certified. So it's all with the global standards as well as the standards that would be required to be fulfilled in terms of security and everything that is required for a device, software-wise, hardware-wise, for a ECG device in India as well. This is the overall product, and it is a pleasure to talk about it because it's highly innovative in the way it is made. It has been made, and it is highly portable. It has been loved by the people who have used it. These are a few insights from the users from US because they were the first one to use it, and we just happened to get it in India last year. And a lot of projects are exploring this particular device right now. So, what are the things that we get to hear from the people who are using it? Basically, the users are, it's a very portable solution. It is different as compared to the bulky and the heavy ECG machines that are currently existing. It quickly fits to the workflow without a disruption. Uh, Few people say that it's a game changer because of its design simplicity, and its AI powered helps them to get interpretation in seconds. And it is very, very critical for things like heart attack or AFib that can be managed in real time, right? Uh, Even there's one more which says about it interprets the ECG with a bit more accuracy than my traditional machine. When I say mine, it is said something by Dr. Tiffany here, right? And then we have Dr. Darren saying that uh, it gives them insights under 2 minutes versus 10 to 15 minutes that usually takes in their hospital. In remote settings where our team may see hundreds of patients a day, that speed isn't just convenient. As I was telling with the start of the presentation, that time plays a major role, and also when reach comes to again a challenge that one is fighting for. Here, this device does wonders. We have more insights from users talking about our device, which says that allows spend more time with our patients instead of waiting for an ECG cart or for them to disrobe. This is from a doctor, Dr. Rob Passman. And he also says that he can confidently take the ECG knowing the quality of the tracing is equivalent to a regular 12 lead. The quality of tracing really matters, and that's again been reviewed by some of the users through through their experiences. Now, how does Kardia 12L, optimize this workflow? It actually, in a way, covers every bit of the ongoing trend, providing a better, perspective or ease of use or efficiency or portability as the values addition in the way it has been made. So it covers time. It helps interpretation skills to correlate with the determinations that comes in. It also makes sure that errors are less because everything is digitally recorded and the placement is again something that is guided. So there is no problem again if there is a lead reversal that has been missed out and then a test has been taken. Continuity and prognosis, everything since is digitally there. It is easy for the patient to also retrieve the information. It is also the easy for the hospital to even retrieve the information. It doesn't allow you to entirely disrobe, so it takes care of the comfort. Golden hour and reach, which is very, very important in cardiac care, plays a major role with an ECG device if it can be offered. And then documentation, that being one of the major best practices that every hospital or a clinic or a setup follows right now, is being again covered through everything being on the cloud and provides easy archiving and easy retrieval of the content or the reports. With this, I'm almost done with my presentation, and I've taken it through. If there are any questions, I would love to have questions from the audience.
There is a question in the QA box.
Okay,
Mr. Govardhan has asked, he's facing a lot of motion electrical artifacts and taking ECGs for newborns. So he's
okay.
asking whether is there any specific features and design that would help neonatal ECG. Can
Thank you. Sure, sure. Thank you for this question. And just to keep you all apprised, this particular device is recommended for adults, that is 18 plus only. It's designed in a way it's not for pediatric, but for adult population.
So is there any future upgrade that you'll give us solutions for pediatric and neonates as well?
That may happen, ma'am, but it's way too early to comment or confirm on this because we are known for innovations in ECGs, and hopefully one day we will have something on that.
There's one more question on how much is the battery backup for the device?
Okay, so as I said that it could two batteries could take around 8,500 ECGs. That's one thing. Second thing is the shelf life of the battery is around 3 years.
Thank you, sir.
Yeah.
And participants may post your questions on the QA box. There's a question from Ms. Tara. It's possible to take right side ECG or lead V8, V9, and V10 and
So
change
I
the speed.
Sure. Yeah, please go ahead, ma'am. I'm sorry. Yeah. Could you read out the full question?
Is it possible to take right side ECG on the lead V8, V9, V10 and possibility to change the speed to 50 mm?
So basically, right now it is recommended only to place the ECG as the positions that are recommended, that is alternate or default settings in terms of positioning of the leads. So if you ask me this question, the answer would be no, because Kardia 12 received FDA clearance only for the default leads, as this particular section says. So this is what is covered currently. The default leads would have V2, V4, RA, LA, LL, and alternate leads would have V1, V4, RA, LA, LL in terms of placements. And we would only recommend on this as of now because these are what is FDA covered or FDA clearances received for this in terms of the placements.
Sir, how about regulatory approval in India for CDSCO? There's a
It's
question
a
on that.
it's approved. It's already
Yeah.
approved. Yes.
Sir, is there any hospital who have initiated using this ECG equipment in India?
Yes, yes, there are plenty of ongoing projects where clinical demonstrations are going on. Few individual practitioners have bought it, and few lab setups have already bought it.
So from the app, we could connect it to Kardia Pro portal, right? How about
Right.
integration with the hospital HIS system or EHR?
So even that is something which is explored, and it's an ongoing process that is happening.
Any questions, participants? Does this require any calibration?
We There is no calibration mandated as such, but standard maintenance wise, if a hospital follows a protocol, they can use a normal ECG simulator to use it. That's about it. It's just as a protocol if they follow, but for the device, there is no such mandated calibration that is required.
Thank you, sir. There's one question inquiry for you from Ms. Rajalakshmi. What is the price for this in India?
Price, since it's only a knowledge imparting thing, webinar, so we would request you to reach out to us. Here you have seen a scanner. You could just scan it out and send us a hi and send us a requirement. We can look into it. Any technical data or any request for demonstration or any wanting to physically see the product, feel free to scan this particular QR code. Send us a hi or your requirement. We are happy to connect with you all. And you could also scan this particular QR code to just get updates on our new innovations or new devices that we may come at, in the future. All of that updates, you will get it out here. This is
Thank
on
you, sir.
WhatsApp, so feel free to scan it out.
Thank you, sir. Hope this answers your query, Ms. Kriti Patel. We have few more minutes left. Any questions from the participant side? We are happy to accept.
Sure. How many more minutes left, by the way?
So we have 10 minutes left, and there's one question from Mr. Hemant Kumar. What sort
Okay.
of device security protocol implemented while it connected to Wi-Fi?
So basically, as I said, that it follows all protection related, layers that is required for a device. But other than that, since it's HIPAA compliance, and if you see, I've also mentioned it as SOC2 compliant. So all of this is compliant. So it's a product that has been used in the US, and uh, we know that anything that is used globally has to go through security protocols, so making sure that the patient data is safe and everything is in place, and that's why all such uh, minute details of protection layers are taken into consideration.
There's one more question from Mr. Virendra Kumar. Can we share the digital report to patients, and what are the options?
Yes, you can actually share the digital reports to the patient. If you see here, a standard 3 by 4 format 12-lead PDF report can be emailed, texted, or printed from the Kardia Station app immediately after the recording is complete. So yes, your answer to you, the answer is yes. And how do you want to do that after recording is complete? Just one has to click PDF report button on the top right on the screen from the full 12-lead ECG report view. And on clicking, the download icon on the top right will pop out, and that will allow you to either print or email or share it through AirDrop.
Like the standalone devices, is there any possibility to store the ECG reports, or how many ECG reports we can store and for how long?
We don't have a limit right now, and the ECG, since it's a software and it's cloud storage, any number of ECGs can be stored.
So your software requires licensing, right? So how many users can use at a time?
So if you see here, in terms of the Kardia Pro users, there is no limit to it. As you say, is there a limit to how many Kardia Pro users I can create with one account? If one device is there, no. Each Kardia Pro account has an unlimited number of users. So to answer you, there is no limit to the number of users or for a specific device.
Thank you, sir. Preeti ma'am, you can scan the QR code and say hi. It's a WhatsApp for them. So they'll be
Absolutely.
happy to help you with the costing, pricing, and everything.
Yeah. Where is Preeti ma'am based out of?
Is the device rechargeable, sir?
Ma'am, it's battery operated. So
Battery operated.
yes, yes. And there is no electrical interference at all in terms of even charging it through electricity or something. So it's only battery operated.
So what type of battery backup we have in that inbuilt battery type of battery?
It's a
Whether it's
two
lithium
it's a
ion or alkaline battery.
yeah, it's two AAA alkaline batteries that are used here, ma'am. There's no need of a backup, so it just requires two AAA batteries.
Thank you, sir. And
Thank you.
we have one last question. Can you
Sure.
explain the technology and techniques used in ECG machines to obtain ECG waves, including formulas and signal processing methods to reduce noise and artifact? Uh, I think, Kodan sir, you can DM him directly so that he'll help you with the same.
Sure,
This is a
sure,
vast
sure.
subject that has to be
Absolutely.
addressed in a separate session.
Absolutely. Thank you so much.
Thank you, sir. Now we have come to the end of the session. We'll wind
Sure.
up with the closing remark. And I extend my sincere thanks to the Almighty who has made this day happening for us to enable this lively webinar through you. And I extend my thanks to the Kaho team, the President, Dr. Vijay Agarwal, and Secretary General, Dr. Lalu Joseph, and our Kaho Healthcare Engineers Forum Chair and Co-Chair, Mr. Vinod Kumar and Mr. Arul Prakash, and to all the Healthcare Engineers Committee and our Office Secretariat, Ms. Preeta and team for hosting this session. And I would like to extend my sincere thanks to you for making up your time and providing us insightful knowledge on this on your new product in Cardia 12L. I hope this will be useful for all the participants who have joined us today. And Preeta, can you share the slides? We have our upcoming webinars on February and March, uh, requesting everyone to join us and get be part of this knowledge sharing event. And our first ISQA regional conference for South Asia, our 10th edition of KahoCon, is scheduled between 11 and 12th April at Chennai Trade Center. I'd like to have your registrations and looking forward to meet you all there. And we have our Healthcare Engineers Forum joining form also for you. So you can scan the QR code and join us and be part of us. We conduct regular webinars on biomedical equipment, and we host workshops on biomedical and engineering infrastructure, fire and safety, and we have our flagship conferences also. Uh, Thank you all for joining. Have a great day. Thank you, Kartik sir. Thank you, Kaho team. Thank you all participants for joining us.
Thank you. Thank you for having me here and wishing you all a great day ahead.